Hello, and welcome to the Smart Injury Doctors Podcast, the injury market's top program for doctors, lawyers, and insurers who want to gain greater insight on how to improve patient recovery results and deliver better services in the U.S. injury market. Please welcome your host, Dr. Jeffrey Allen Kronk.
Hey, doctors. Today what I want to talk about is this idea that you can see ligament injuries. It comes up, and it comes up a lot, and it's a unreality. It's not true. I have probably more experience with looking at spinal ligament injuries and excessive motion studies. And remember, there's two bioimaging markers for injury. So a bioimaging marker is something that definitively defines something. So if a fracture. If you have two bones that are separated on an X-ray, that's a bioimaging marker for a fracture. A bioimaging marker for a disc condition is a herniation found on MRI. A bioimaging marker for a spinal support ligament injury is excessive motion on a functional X-ray study. So, and those are the most common, those are the most problematic injuries in the market today. The doctors that actually treat and can successfully treat these, and when I say successfully, I mean cost effectively and getting great results, should be paid the most money in the market today. Those are the real experts in the market. So, when somebody says, geez, they're an expert at something, but they can't do something, I don't know how good of an expert that person is. So, you could have an expert at MIT that is the top expert in the world and knows everything there is to know about building bridges and the engineering behind it, the logistics behind it, knows everything there is to know about building bridges. Only problem is he's never been on a bridge site, or when they go on a bridge site, they actually can't build a bridge. So they're an intellectual expert. Today, there are far too many intellectual experts, and I hear it all the time. I hear it with coaches and trainers. And intellectually, some of these things make sense. But if you've been on the bridge site and you actually built a bridge, then you know that 90% of what the educator is educating is actually not important. But the real value of somebody that can build that bridge is they know the 10% that is of utmost value. They know what's real, they know what's true, and they know what's not true. They know what's fluff. So today, the idea, and there's so-called experts in the market that have done no excessive motion testing. They haven't seen 100,000 studies. They haven't seen 100,000 X-rays. They haven't reviewed it. They haven't built systems that produce it. They have relatively no expertise, other than the fact that they're a doctor. But a doctor with no expertise in a particular area, they've never done what they supposedly have expertise in my world, is no expertise at all. So this idea comes up a lot that people can eyeball. I'm going to eyeball these X-rays, and if I see something, I'm going to send out for an excessive motion study. I get it, but it's a false idea. And the reason why it's a false idea is because you cannot see, particularly you cannot see angular findings. So I've reviewed over 100,000 films easily. I've assisted with correcting 2 systems early on in my career. I built 2 systems and then helped to build an AI system that auto detects these conditions. So I have a lot of expertise that I never thought I would get into, and I'm telling you, I can't see them. Now, if you can see them, fine. I'm not going to contest it. It's just you're the rare bird that actually can see them. But what I can tell you is when you're making those assertions, you are invalidating the condition completely. Spinal ligament injuries are the most significant injuries there are. If you want to assess for them, you have an excessive motion test on them, and you want to get with a credible provider that can produce it. You want it to be an unbiased, independent study whenever possible. The ramifications of excessive motion for us in spinal with Spinal Kinetics, the company I'm a CEO, the medical company that delivers excessive motion testing, we have about 30% of our studies will come back with a rateable finding. That means that's a surgical level of injury. And the providers that do this type of testing don't invalidate that, right? They know it's significant. They know it's very important. So for every 100, 30 patients have that level of injury. Now, that doesn't mean that the abnormals can act worse than the severe ligament injury. So a grade 3 sprain can be less problematic for some people than a grade 2 sprain. So the injuries are the same. The thing you're looking for is the same. The people that have these injuries are all different. But here's what I'm going to say. When you have a patient that comes in that has a spinal injury, if you're not testing, you're basically saying that they don't have a significant spinal support ligament injury. So you're invalidating right from the get-go the significance of what you do as a spinal injury provider. And that's the part that kind of gets me, because you can't see the people that actually say, well, I'm going to review this. And please, if you're at one of these doctors that does this, please don't take this personally. I've just been doing it for far too long. You're oftentimes letting the finance or the economics or attorney referrals dictate what you're doing. If I really got down to it, I've worked with too many providers too long, but I don't invalidate this condition. That's why I've been in it so long. That's why I've started 2 companies that deliver these services. That's why I programmed softwares. That's why I helped with AI. That's why I do this. I don't minimize the condition. It's one of the most significant conditions there is in the market today. It's the most problematic condition. And again, the doctors that do this type of work and can get good results with it should be the highest paid. Now, there's confusion. There's a lot of confusion in the market. That's why so many people are in chronic pain. Remember, 50% or more of the patients that experience a spinal injury are never going to fully recover. That's not bad patients. The patients have always been the same. They're the ones that have the condition, right? That's bad doctors. That's bad lack of innovation. That's bad. Hey, we're not seriously getting in here and trying to resolve it. The first step to resolving it is understanding what you have. So when a patient comes in, of course, the most problematic thing you're looking for is a ligament injury. Spine only has 2 parts to it, bone and connective tissue. There's one bioimaging marker for bone injuries that's called fractures. You pick it up on X-ray or CT. There's an imaging biomarker for the disc. That's herniations picked up on MRI. There's a bioimaging marker for the spinal support ligaments. Those are the most problematic. Those are the most pain-causing. Those are the most symptom-causing. That's the key to mild traumatic brain injuries and mild traumatic brain injury recoveries in my world. That's the key to chronic pain evaluation. And once you understand what you're doing with this in acute pain, in acute cases, acute trauma cases, you understand, and you can become the top chronic headache specialist, chronic neck pain specialist, chronic low back pain specialist in the country. Right? Because you understand the condition. But in order for you to get to that level, you can't invalidate the condition. You can't invalidate the condition. So a cardiologist does not invalidate heart failure. Now, heart failure, the test for heart failure is an echocardiogram. All right? It's an ultrasound of the heart. The heart is beating. It's contracting and relaxing, contracting, relaxing, contracting, relaxing. I'm sure the top cardiologists in the world can look in and say, hey, there's some reduced function with that heart. But they couldn't tell you how much. They certainly could not tell you how much. And they couldn't tell you, hey, look, I had an echo 3 years ago, and it was normal. And now the person suffered a severe chest injury. We feel the heart was damaged. And so now I cannot tell you how much loss of function based on looking at the old and looking at the new by eyeball. Now, you don't want to know why? Because heart function is a measured phenomena. It's not a sight phenomena. Excessive motion in the spine in a spinal injury is a measurement phenomena. It's not a sight phenomena. I could be with anyone that wants to challenge that. Please, it's the easiest challenge in the world. I used to do it when I was out doing seminars where we just put up 5 or 6 x-rays. Just put up a set of x-rays, 100 doctors in the room, and say, okay, there's a serious ligament injury here. Where is it? Where do you think it is? 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 And everyone has a different idea. And everyone in the room is guessing. Now, there's some obvious things that you could see, but if I put up an angular finding, you won't see it. You'll guess at it, and those are 50% of your findings. So, I don't know a patient in the country that once this becomes more and more prominent, and one of the reasons why I do so much work on this, and we set up a Smart Injury Doctors program, and we set up, I set up technology that detects this, and I set up medical service that delivers it, is it's such an important condition, and it's an important condition to understand so that there can be long-term resolution of a patient so they don't have to experience chronic pain. My mission was to standardize spinal injury workups. They should be done the same provider to provider. And the excessive motion test should be done on every single patient where it's suspected there's a spinal injury. Now, there's only two things you can injure, bone and connective tissue. So obviously, if you suspect there's a fracture, you have to rule that out first. That's primary. But the majority of cases, I was in cases for years, 17 years in private practice. I treated a lot of spinal injury patients. And yes, I treated patients that had fractures, right? Healed, or they're healed up. They've had compression fractures as a result of their injuries. And we did all kinds of amazing, successful things with them. Not when they were in the acute. You have to let that heal up. But the ligament injury is also very important, and it's very important to address. So again, that condition is very, very important, but there's no BS to the fact. You can't look at it and say, well, I can look and I can see these things. You just simply can't do it. It's no different than doctors say, hey, look, I'm a diversified adjuster and I adjust a hypomobility and I don't adjust the hypermobility because I've got a C4, C5 that's hyper and a C5, C6 that's hypo. So half the segment is hypo and half the segment's hyper. And I'm so specific that I can go in with a diversified adjustment and just hit 5 and 6, but never touch 4 and 5. Okay, you can say that to yourself, but it's not true. It's totally not true. So it's better to understand what it is you're doing. What is your treatment doing? What is that adjustment doing that's having such a significant effect on that ligament injury and its recovery? That's the real thing. That's where you want to be. But, what I do is on each podcast that I do, I just take a short message, just a short message, things that come up. If you want a full understanding of how injured your patient is, you have to do an excessive motion test on them. There's no other way to do it. Now, for me, it's the easiest way to understand what the patient has, to get better results with the patient, to communicate better with the patient, to set my clinic apart, to get patients to understand what sets our clinic apart so that they can actually explain and I can develop internal referrals. It's the easiest way for me to go out and assert my expertise in the mild traumatic brain injury space or in the injury referral space and the set up relationships with medical doctors, set up relationships with attorneys, and to seriously assert my expertise. That's where you are an expert, and it's the easiest thing to do, but don't invalidate yourself. When you minimize your own condition, you're minimizing yourself and you're minimizing your profession. I don't contribute to that. That's why, I get so specific with this particular topic. I don't invalidate the significance of the condition. So doctors, short, sweet, hopefully you got something from this. If you have questions, you want to know more about my program called the Smart Injury Doctors Program, where we help providers to, take over a niche within the spinal injury market and what to do and, how to improve your practices with that, go to www.smartinjurydoctors.com or call us at 800-940-6513. If you have interest in testing, call Spinal Kinetics. Just go to thespinalkinetics.com, look up the company and set up an account and get testing. So doctors, as always, I appreciate your time, your attention. Most importantly, though, I appreciate what you're doing on a day-to-day basis, and I know how hard it is, but I know how valuable you really are. And so if anything I imparted today helps you to improve and increase your own value, then I appreciate that. I thank you, and I look forward to delivering more content on the next podcast.
You've been listening to the Smart Injury Doctors Podcast, the #1 audio production show for professionals in the U.S. injury market that want to deliver better injury services to the patients, clients, or insureds they serve. If you like what you heard today, please leave us a review and don't forget to join us on our next program.